Okay, this is my patient Denise. It's now been a year, exactly to the day, since we gave her her first shot of stem cells into her right knee. And she was in a lot of pain before, so it's now been a whole year. What is it like now?
It's amazing and always getting better. I think that's the thing that surprises me, because every time I think, oh, this is so much better than it was before, it just keeps getting better. I couldn't sleep at night from the pain. That's all gone. I couldn't walk upstairs. I'm walking upstairs. I still have a couple things. I have a torn ligament, unfortunately. That's going to take a little bit longer, but it keeps getting better. It's like, if I think about 6 months ago, I know where I am now. My husband's noticed. My children have noticed. Everyone's like, this is pretty amazing how this has transformed who I was, because honestly, a year ago, I was really quite depressed, didn't want to go anywhere. I'm out doing water fit classes now. I do water fit 4 times a week, and I have no problem with that. I just got into a college class because I'm retired. Now I'm going back and taking classes, walking around. I'm never concerned that I'm going to fall. You know, before I wouldn't go anywhere because I was afraid I was going to fall. My knee would buckle and I'd go down. It's embarrassing. It's hard to get back up when you have a sore knee. I go everywhere. I don't even think about falling. I don't think about anything happening to my knee because it's just so stable. And the more I exercise, the more stable it becomes, and it just keeps getting better. I just don't even know how to express how that feels when you have something that hurts so much and has impacted your life in such a negative way, and now all of a sudden it just keeps getting better. Every day it gets better.
That's such an awesome story. I'd love to hear that. So today we're just doing a what we call PRP booster, platelet-rich plasma from your own blood. The plasma contains the kind of the workers, the anti-inflammatory and growth factors, cytokines that help to kind of just keep it going. So we're going to keep the stem cell activity and effects just continuing to kind of rebuild. So awesome. So thanks for your story.
Oh, I love it.